My name is Sheila, and I'm with the Healing Sanctuary. And this is a very simple post abdominal surgery yoga routine that can be done in most cases right away because we won't be doing any stretching or engagement of muscles in the abdominal area. We'll be focusing more on joint mobility and helping the lymph flow and circulating the breath. And this routine is done all laying down, so you can even do it in your bed if you want, or anywhere that you're comfortable. And I've got a couple of just normal bed pillows here in case I need them, as well as a bolster. So you want to make sure that how you're laying, you're completely comfortable, whether it's on your yoga mat or in your bed. If you want a head under your pillow, or a pillow under your head, or a pillow under your knees, just situate yourself in that way. And at first, your hands can either be on your abdomen, just lightly resting, if that feels good, or along your sides, if that feels better. And go ahead and close your eyes and think of the rib cage kind of like a barrel, and it expands in every direction. For today's practice, if you just had abdominal surgery, we won't focus on deep belly breathing, so we don't necessarily want to focus on expanding the diaphragm into the belly and that aspect of breathing. More just a gentle expansion of the rib cage, particularly the upper rib cage. So first, you'll just inhale and imagine the breath going out to the edge of the lungs, towards the heads of the shoulders, helping your shoulders draw back towards the bed or towards your yoga mat. And slow, gentle exhale. Inhale, back out to the heads of the shoulders. And exhale. Once more, inhale, letting the shoulders drop back. And exhale. And now as you inhale, shrug the shoulders up towards your ears, as high as they'll go. And then exhale, draw the shoulders down, as far away from the ears as they'll go. Inhale, shrug up. Exhale, down. Inhale, up. Exhale, down. And then inhale, bring your arms up towards the ceiling and overhead, just as far as they'll go without stretching the abdomen. And then exhale, back up and back along your sides. Inhale, up and overhead. Exhale, back down. Inhale, up and overhead. And this time, keep them overhead. It could be that they're resting up at a diagonal a little bit. Depending on your shoulder flexibility, they might come all the way back, or you can also bend your elbows and just get a nice gentle stretch. You can shift the arms to the right a little bit, and even stretch through the armpits, even a little side bend through your neck. And if it feels good, so we'll stay here for a little bit. If it feels good, you can also cross your left ankle above your right ankle. So we're in a little bit of a side bend, but not so much that you're stretching at the waist. More just through the armpit and through the left hip. And we'll send your breath to the side ribs, just a gentle breathing out to the side ribs, particularly your left side ribs. Just very gently. One more deep breath. And then we'll bring the arms back to center. If you crossed your ankle, uncross it. And bring your arms over to the left side. And the arms can be bent if needed. And just get a gentle stretch through the armpit area on the right side. And if it feels good, you can cross the right ankle over the left. And gentle breathing into the side ribs, expanding, but just a little bit. And especially the side ribs on the right side. Just creating a little space in the armpit area with the breath. And a little space in the upper ribs on the right side, the upper side ribs. One more deep breath. And then bring your arms back to center, uncross your leg, and we'll just do some snow angels. So you can bring your arms along the bed or your yoga mat back to the side, and then all the way back up overhead, as far as comfortable. Back along the side, and can use the breath with it. Exhale, back to the side. Inhale, back up. Exhale, back to the side. Inhale, back up. Once more, exhale, back to the side. And now rest for a couple breaths. And relax the eye muscles. Relax your jaw. Let your body melt as heavy as possible into the bed or the yoga mat underneath you. And next we'll work the ankles and the wrists. So you can, starting with the wrists, you can make some rotations going in one direction. And the other direction. And rest the hands, rest the wrists. And then just go ahead and bend the elbows, and we'll do some gentle shaking. All the meridians that in the upper body pass through the wrists. And so in doing this, it just helps open up those meridians that pass through the wrists, the arms, the hands. Couple more breaths. And then just go ahead and let the arms, hands rest again. And notice any different sensations in the arms from shaking it out. And now go ahead and just make some circles with the ankles, just going in one direction. And the other direction. Back to center. And then point your toes as far as they'll point. Then flex your feet, drawing your toes towards your head. Point your toes, flex your feet at your ankles, and point and flex, and back to neutral. Then supporting yourself, next we'll work on the hip joints a little bit. So if you need to, so just bend your knees a little bit, trying not to engage the abdominal muscles. And you can even use your hands once your knees bent. And just take your knee with your hands if that's comfortable. And we'll make little circles going in one direction. And if it's more comfortable, you can clasp behind your thigh too. And you're using your hands rather than your abdominal muscles, just making circles. Make circles the other way. And back to the center. And then just support your knee with both hands. And we'll bring it out. Actually, you can let go of your right knee with your left hand. And just gently bring your right knee out to the right until you feel a little stretch. And the stretch is more in the hip joint. You don't want to have the stretch be so much that it gets into the abdomen. And you're totally supporting your leg with your arm. And then we'll bring it back to the center. And now switch hands. Take your knee with your left hand and just slightly bring your knee to the left. So you feel a little stretch through your outer right hip and your IT band. And if you want, you can make little movements forward and back. Maybe it feels good to have it at one angle or another. And now before lowering the right knee, we'll bring the left knee up. So just very slowly, you can support your left knee up Try not to engage the abdominal muscles, and then use your hand to help bring your left knee up, taking your knees one with each hand. And we'll draw circles, just making little circles as though if you had a flashlight on your knees, you'd be making a circle with the light at the ceiling, going in one direction. And the other direction. And back to the center. And now support your right knee, your right foot back to the mattress or back to the floor, and you can lengthen your leg again. Keep your left knee up, and we'll do the same thing with the left knees that we did with the right. So make circles in one direction, just slowly. Make circles in the other direction. And keep your left knee with your left hand, and slightly bring your knee out to the side without stretching the abdomen. So just until you feel a little stretch through the inner hip. That's it. And now bring your knee back up to the center. And change the hand positioning. So you've got your left knee with your right hand now, and just cross it over just a little bit. So both hips are still on the floor. And you're getting a gentle stretch, hopefully, through the outer hip and IT band. And you can move the knee up and down a little bit. It might feel good one angle or the other. And then we'll bring the knee back to the center. And support the foot back to the floor and mattress, and lengthen your leg. And then you can either rest your hands lightly on your abdomen or along your sides. And we'll return again to some deep breaths. So we brought the breath out to the heads of the shoulders, and we brought the breath out to the side ribs. And now we'll bring the breath up to the top of the lungs, which actually is way at the top of the shoulders. The first rib is at the top of the shoulders. And you can see if you can bring your breath all the way up, feeling as though it's expanding towards the top of the shoulders, towards the top of the lungs. And exhale. And inhale. And exhale. One more at this spot. And now we'll bring the breath expanding the rib cage front to back. So you can think of the sternum or the breastbone and then the back of the heart space. So as you inhale, feel the sternum lift away from the back of the ribs, just gently. And exhale, allow the sternum to draw back down towards the back of the ribs. Inhale, expanding front to back. Exhale, the sternum draws back down. Once more, inhale. And exhale. And now we'll go into a little shavasana or resting, just integrating all of that. So, and you can just let your body sink heavy into the bed underneath you or the yoga mat underneath you, relaxing completely. And we'll go through a series of 61 points of light. So with each point, you'll imagine with your eyes closed as though a star is getting brighter. Starting with the center of your forehead, imagine a star there, getting brighter. And down to the center of your throat, a star getting brighter. To the head of the right shoulder, right elbow, wrist, right thumb, index finger, middle finger, ring finger, pinky, wrist, elbow, shoulder, throat, left shoulder, elbow, wrist, thumb, index, middle, ring, pinky, wrist, elbow, shoulder, throat, chest, right chest, center of the chest, left chest, center of the chest, belly button, pubic bone, right hip, knee, ankle, big toe, second, third, fourth, fifth, ankle, knee, hip, pubic bone, left hip, left knee, ankle, big toe, second, third, fourth, fifth, ankle, knee, hip, pubic bone, belly button, heart center, throat center, forehead center, all 61 points shining brightly. And just rest here, rest deeply. This concludes the yoga session, but you can stay here in Shavasana resting as long as you'd like. And again, always consult with your doctor before doing this yoga flow right after surgery, but you can let them know that it is a yoga flow that does not engage any of the abdominal muscles, and it's very, very gentle. So in most cases, it should be fine right away. And I hope you feel very relaxed and that the circulation is flowing and that you have speedy healing.